Good evening. Sad night. Liam Neeson, his sons, and the entire family, this is the statement released by the family, are shocked and devastated by the tragic death of their beloved Natasha. They're profoundly grateful for the support, love, and prayers of everyone. They ask for privacy during this very difficult time. Joining us to begin things here in Los Angeles, Mark Steinis, the co-host of Entertainment Tonight. Michael Fleeman, the West Coast editor of People.com. The Natasha Richardson, her tragic accident, is the cover story of the latest issue of People, which will be out on Friday. And Dr. Neil Martin, who was with us last night. The doctor is professor and chief of neurosurgery, UCLA Medical Center. Mark, we can't say this was shocking after yesterday.
Yeah, well, this was a story that, you know, we have been following all day. In fact, on my drive over here, which I'm just getting in, confirming the statement came out. I was all prepared to say, let's not move too fast on this. Let's wait to hear from the family. Sources were saying all along that it didn't look good. It was grim. But we were keeping, you know, our fingers crossed that something would come from this and positive news, and it's not the case, as you just read the statement from the family.
Now, Michael, you've got a story coming on what?
Well, we're sort of retracing the final hours and days of her life. And the tragedy here is that in the beginning, when this was a relatively minor ski accident, she even laughed it off, didn't go immediately to the hospital, and then everything just went downhill after that. And so it was shocking in that respect that it started out the way it did and ended up so tragic.
So the story won't have her death.
No, it won't. At the time that we went to press, we were certain that it was a devastating head injury, and it looked like that she wasn't going to make it.
Doctor, you were with us last night, and you were very pessimistic last night, so obviously. But the obvious question was, it was a small slope, and she was laughing. What do you guess happened?
In some cases, even a fall from a few feet, from standing erect to hitting the ground, can be enough to cause a serious injury, if you can't protect yourself. If your head hits hard, then your brain collides with your skull and a serious injury can occur. We have to be cognizant of the other possibility, and that is that maybe there was some pre-existing condition that may even have triggered the fall and then snowballed.
You mean a condition that would cause her to fall?
She may have had a minor leak from a brain aneurysm that then ruptured more severely several hours later.
So we're not going to know anything till autopsy, right?
No.
You brought this, this is what, the diagram of the brain?
Well, this is a model of the brain, life size, and you can see the blood vessels on the surface of the brain, and the blood vessels are what are vulnerable in even a minor injury. So if the brain suddenly moves, the blood vessels can be torn or stretched, and they may leak or bleed more aggressively, and that can cause a collection of blood that puts pressure on the brain, and that can become life-threatening and even fatal relatively quickly.
Dr. Black, who was with you last night when we were walking out, he said the key here is when they didn't announce anything about surgery. If they're not doing surgery, it doesn't look good, meaning?
If someone has lapsed into a coma after an injury like that, certainly a scan, a CT scan of the brain would have been done. If they saw a correctable problem, like a local collection of blood, then a craniotomy, brain surgery, would have been done right away. In this case, there was no announcement about any surgery, and so one only has to guess that they either saw nothing correctable or there was such massive damage right from the beginning that surgery wasn't going to help.
What's that over there?
Well, these are specimens from the pathology library that show what an actual injury to the brain looks like.
Can we get a shot of this?
So this is bleeding over the surface of the brain, and this is the cause of the problem. You can see how this side of the brain is moved over, it's compressed, it's under tremendous pressure, and the progression of that problem is what causes brain death.
And when someone is brain dead, they're dead, right? Even though the heart is beating.
Exactly. When the brain is gone, we can sustain a heartbeat with life support, but that doesn't mean that the person is there. When the brain function is gone, the person's gone.